Hello, everyone. Welcome to 5 Minute Video Study for the NCE. We are in clinical focus, and today we are in subcategory AB, retirement concerns. Um, the realities of retirement is that retirement is changing. Traditional retirement looks very different than it has had in the past. People are living longer, and you know, the birth rate in America has declined drastically since the mid 20th century. So, with that, there's been a lot of concerns with retirement. And if you look at the lifespan development, Erik Erikson stages, that's part of that developmental stage, which is now, looking very different than it has had in the past. So, one of those differences is that individuals may not fully retire, or may go and work part-time, or may completely go into a completely different field. Most retirements now in America is what we consider involuntary retirements, where a person can no longer, or is not no longer able to do the physical or the mental capacity to continue to do that job. So that's a consideration. There's also the term which Dr. Primavera labeled as working retirees. So those are individuals that still have some sort of employment, even though they're considered to be in that retirement category. So maybe going from full time to part time, or now I know that there's a trend where individuals do consulting, especially if they're highly educated, or they have a very specific niche that they can then consult different sectors on. So with that change, it does bring different mental health concerns, right? Because a lot, maybe if a client feels like they haven't saved enough, or they feel like retirement isn't an option for them, that can certainly create different financial stresses, or their health is declining. Then that can certainly implicate their mental health. Dr. Primavera, who did different surveys on retirement and kind of what that looks like, they emphasize the importance of structure, right? Keeping a routine, having things where you know what to expect, because many times in retirement, you lose that structure, right? You don't have to go in, or you don't have that 9 to 5, or you don't have that traditional structure that a job offers. So, they mention the importance of structure, especially when dealing with the changes, and being able to continue with that structure. And even if it's not the traditional job structure, having other activities that could be engaging and providing that structure. Also, the importance of community. So looking at building community, whether it's with other retirees, or in a setting where you have access to people with similar interests. So not losing touch of those connections, or even building new connections in order to strengthen those relationships. The other thing that I think it's an important consideration is the notion of loneliness. You know, as individuals get older, they tend to have a higher level of loneliness, and again, that's associated with things like depression and other mental health conditions. And finally, it's important to understand that not all one size fits all for everyone. And it's important to consider the individual and how that individual is making sense of those changes. So those are just some considerations to consider when a person is having concerns with the notion of retirement and kind of what that life stage looks like.